Hello, my name is Andrea Sartore-Bianchi. I'm medical oncologist at Niguarda Cancer Center and the University of Milano in Milano, Italy. And it is my pleasure to provide you with a newsletter with most relevant presentation from the ASCO annual 2023 Congress and the World ESMO GI Congress that was just held in Barcelona. We had many interesting presentations, and I will focus on those presentations that are particularly relevant in the field of precision oncology. So I will start with the ASCO Congress, and at the ASCO Congress this year, it was presented results of the DESTINY Pan-Tumor 02 trial. We know that the DESTINY trials are those trials with the drug T-DXd, that is an anti-HER2 antibody-drug conjugate. We know there are already application of this drug to breast cancer, gastric cancer, non-small cell lung cancer, and emerging application in colorectal cancer. But we know also that HER2 is a target that you can find across various solid tumors. And it was very interesting to have this data regarding the application to other histologies, such as ovarian cancer, cervical cancer, bladder cancer, and biliary tract cancer, for example. And in these tumors, the main message from the trial is that you can have very good activity, particularly in those tumors with the 3+ immunohistochemistry expression, as compared with those 2+ with H amplification, with a very good duration of response. And also, we know that this drug has the major advantage of being active also in those patients that previously received another anti-HER2 treatment. So my perspective in this trial is that this is a really important avenue for development of T-DXd beyond the tumor that we know are really sensitive, but also to many other tumors that are HER2 overexpressing, and particularly in those overexpressing HER2 at the 3+ level. Also from the ASCO Congress, we had initial data with the anti-KRAS G12C drug GDQ443 in non-small cell lung cancer. Now we know that G12C mutation in KRAS is an emerging target with various compounds, and the GDQ443 is a structurally unique KRAS G12C inhibitor, very potent. And results from the trial presented at ASCO in non-small cell lung cancer is referring to the phase 1b part of the development of this drug. And from this trial, we had very good results in terms of disease control and partial responses. And also the safety and tolerability is very well. So to me, it's very interesting to look at this newer compound with a peculiar activity and more potent activity, and also particularly for combination. Because given the good tolerability of this drug, we know that this very same compound, GDQ443, is now under investigation for combination in several solid tumors, for example, with anti-PD-1 like tislelizumab, but also with other inhibitor in the KRAS axis like SHP2, and therefore we expect to have also improved results with these combinations. And finally, from the ASCO 2023 Congress, I would like to mention a study with larotrectinib performed in an infantile fibrosarcoma setting. So this is a pediatric population. We know the value of NTRK fusion as a target, and larotrectinib was already used in this setting, but for the first time in this study, it has been used in first line, and the response were high. Almost all patients obtain complete or partial response, but also the study is clearly indicating also the value of local control following also a complete response or a partial response in order to have the best data in terms of disease-free survival, progression-free survival. Now switching to the World Congress on Gastrointestinal Cancer by ESMO, many presentation was of course of interest. I like to focus on a presentation about the value of molecular profiling in survival in patients with biliary tract cancer in the metastatic setting. Why this is the case? Because this tumor type is very much enriched for molecular targets, for example, FGFR fusions or amplification, or IDH1 mutation, or HER2 or 3 amplification. And in a presentation that was made by the group of Gustave Roussy, it was possible to clearly show that profilation by NGS looking for target and then accordingly using a matched therapeutics is providing benefit in terms of overall response rate, but also in progression-free survival and overall survival. And therefore, this is clearly indicating the importance of having an NGS upfront in this kind of tumor. So I thank you very much for your attention, and just remind you that you can also find the slides from the presentation that I included in this newsletter on the core2head.com website.